So let us take up two interesting remedies from Alan's keynotes today. We are discussing a few remedies which are hemorrhagic in nature, and there are many offshoots of the remedy which are hemorrhagic in nature. Some symptoms which are in comparison with the other remedies scattered across the materia medica. And in Alan's keynotes, we have discussed in the last 3 months many remedies. And today we'll discuss something that is, related to the remedy we discussed yesterday. In the last past few days, one of the remedies is Bovista and another is bismuth. So let us take up bismuth. Solitude is unbearable, desires company, and the child holds on to the mother's hand for company. Kalikab, Lilium tigrinum, and Lycoa, the other similar remedies mentioned. So, whenever we see children who are holding the hand of mother or the relative, we think of remedies pulsatilla, we think of remedies chamomilla, senna, we think of arsenic, calcarea carb, but rarely do we think of some remedy which is known as bismuth. And we should have our own parameters to prescribe these smaller remedies, because they are going to do the magic for us when the other remedies fail. And how these remedies will do the magic? When we will be able to find the components of these remedies in from the materia medica, as we see in the patients as well. For bismuth, it is some gastrointestinal disturbance with sense of loneliness or desire to cling to the person who is nearest to the individual. So you have anguish. He sits, then walks, then lies, never long in one place. So bismuth is a remedy which will not be something that you will come regularly across, or you will be able to routinely prescribe, like calcarea for cold clammy perspiration or lacasis for loquacity in children especially. But for bismuth, what you will see is someone who wants company all the time, who needs someone to be there around, especially the children will be the state. Or you will see this state which is in extreme old age, where you will see that similar state is present. Old people cannot stay alone. Headache returns every winter, alternating with, or it is associated with gastralgia, gastric kind of a distress. Face is deathly pale, blurring around the eyes. We see this expression, face deathly pale, blurring around the eyes, scattered across many remedies. And if it is present with the remedies of gastric disturbance, then we should, with the complaints of gastric disturbance, then we should think of bismuth as very, 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 very strong indication. Toothache is better by holding cold water in the mouth. Bryonia, coffea, and pulsatilla are very close. So toothache is an entirely different category altogether. If we know how to understand the different modalities, very easy to get modalities from patients rather than sensations. Relying on modalities will help you in your practice rather than relying on sensations. At times sensations will help, but you will need to get it exactly from the patient and translate it to the repertory or the materia medica exactly. Otherwise you will be misled. Stitching, shooting, lancinating are categorized into single category in certain repertories. In some repertories they are different. For the patient it will mean different. So there are a lot of loopholes in understanding the sensations, but the modalities will never cheat you. For the bismuth remedy, gastrointestinal system, you see that there is vomiting of water as soon as it reaches the stomach. Food, if retained longer, it is expelled immediately. Of the vomiting is of enormous quantities, lot of quantity of vomiting. You will see that you will ask the patient how much vomit is happening, and the patient will tell that I feel as if the entire bowel contents are emptied exactly in front of me. And it is after every few days. So as soon as the fluid is taken in, it is vomited as if the entire contents of the bowels are out, and there are purging and offensive stools. If there are watery stools, you can think of veratrum. If there is offensive, you can think of podo. You can think of bismuth as one of the top remedies. There is an element of gagging and inexpressible pain after laparotomy. This is the state with nux vomica, staphysagria. Bellispera is indicated in such cases where abdominal surgeries are done and some pain is remaining. Bismuth can be thought when there is gastric disturbance after these surgical operations or the abdominal operations are done, and there is kind of a vomiting or offensive and lot of quantity of stools which go on and weaken the patient. Stomach pressure is there in the stomach as if a load in one spot, alternating with burning pain, crampy, spasmodic, with irritation, gastralgia, cardialgia, and pyrosis. So, lot of patients will tell you that there is a distress over here in this part of the stomach, and I cannot seem to get over it. There is constant pain or stuck up feeling. This should be your indication to prescribe bismuth, or at least think of bismuth if not prescribe, because we always tend to omit remedies like Abies canadensis, Abies nigra, Kali bichromicum, bismuth, and we go for some other remedies which are suited for gastralgia or acid peptic disorder like carbo-veg or china or nux vomica, but these remedies will do the magic. Abies, bismuth, Kali bichromicum, and so on. Now next we have in bismuth is cholera morbus, summer complaints when vomiting predominates. Stools are foul, pepescent, watery, offensive and very prostrating. You see the similar situation with arsenic, with veratrum album, and it is present in bismuth also. There is lot of quantity of discharges. It can be vomit, it can be stools, and there is lot of weakness. And if the vomiting is more than the number of stools, think of bismuth. If the number of stools is more than the vomiting, think of podophyllum. That should be your way of thinking. It is also a remedy which can be given in summer, bismuth. Podophyllum is also a remedy which can be given in summer. So once you understand these nitty gritty things, and you will be able to easily identify what remedy needs to be given to the patient in the clinic. Most important, if you want to learn about interesting ways to prescribe, go back to your source books. For example, for podophyllum, very nice case is given by Kent in his lectures of Materia Medica, where he sees that the child is passing the stool throughout the cabin itself or throughout the home itself, the mother tells, and there is lot of offensiveness which bothers the mother, and the patient sees that and prescribes podophyllum. So the next remedy which we should cover is Bovista, which is also a small remedy. Stammering children need this remedy. We give stramonium mostly to such cases, but Bovista is one of the most underrated remedies for stammering of children. The Bovista as a remedy, if you see, it is having discharge from nose or all mucous membranes, which is very tough, stringy, tenacious. Kali bichromicum is very similar to this remedy. Usually there is deep impression on finger from using blunt instruments, scissors or knife. So all those cases who have dermatographism in your clinics, they report to you with urticaria, and they tell you that I have this urticaria since 20 years, and also I have this very irritating urticaria which kind of dermatographism which leaves a deep impression. If I scratch that part, those patients, if they have an acute complaint, they will require Bovista as a remedy for their acute states, and the chronic remedy whichever you are giving, calcarea carb, phosphorus, can do its work very easily. Intolerance of tight clothing around the waist, calcarea carb, lachesis, sulfur are the other remedies. Bovista is one of the remedies. Sweating is there in axilla which smells like onion, very rare to see, very rare to hear that, but if you can get a chance to prescribe Bovista. Patients may not be able to identify the smell correctly, so you will need to ask them if it is correct or if it is the case as a confirmatory symptom. Very rarely you will get to understand the perspiration, smell and prescribe on them. So there are other pointers for prescribing Bovista. One of the pointers which is similar to creosote, the remedy that we discussed yesterday, was that there is hemorrhage after extraction of teeth. Hemamelis, a remedy which we discussed 3 to 5 days ago, has also this similar hemorrhagic tendency from all the discharges from wounds, epistaxis, and this same is the situation with Bovista. In Bovista, one of the interesting things which you will very commonly observe in your patients is that they are very awkward. They will stumble upon things, they will either not handle things properly. Maybe you can confirm this from the patient that if you are handling certain object or certain thing, is it okay if you hold it tightly, or sometimes it falls from your hands by mistake. Sometimes this happens. And if the reply is in affirmative, think of Bovista as a remedy. There is awkwardness, inclined to drop things from the hands, objects fall from powerless hands. Same is the case with Natromur also. I have seen many patients and prescribed Natromur as a chronic remedy when they come to me and they abruptly open the door and throw the file at me as if they have come to get themselves checked like a VIP treatment, or they can stumble upon the weight machine, or they can fumble while climbing the bed over here. Same is the case with apis also. It also has a certain quality of awkwardness. Next you have is for Bovista, it is written that it is adapted to old maids with palpitation. You will see females who suffer with lot of palpitation complaints. Think of Bovista. Other remedy you can think of is Calcarea ars. Interesting case with the female reproductive system. The menses flow only at night, not in the daytime. Metcalb has its similar feature, and if it flows only during the day but ceases when lying down, Cactus, Causticum and Lilium tigrinum can be thought. Diarrhea is there before and during menses. You will see that most of the magnesiums and Bovista have similar complaints. Magnesium also has this kind of complaint, diarrhea or breast or mammary affections before or during menses. Ammonium carb has diarrhea before and during menses, and same is the case with Bovista also. Occasional show every few days after between periods. Also similar situation is there with borax, and every 2 weeks. This we saw in the remedy Thalaspi bursa pastoris, that every 2 weeks there is a bleeding which is happening. Bovista as a remedy can cure such patients, or at least establish the regularity of the periods rather than cure them. And in lot of these hormonal troubles, you will need a series of remedies rather than just one remedy to do the work. You have to understand that there are 4 hormones at work all the time, and there will be a push required for each of the hormone, and that's what you can do by giving different remedies at different intervals as per the need of the patient. Sometimes some patients will get well on one remedy, some patients may require push with multiple remedies. You can choose it according to the state of the patient. Next you have is for Bovista, the menses are every 2 weeks, dark, clotted. Same is the situation with many other remedies in Materia Medica, but over here it is sepia like symptom which is bearing down pains like sepia. There is great weakness of the joints, weariness of the hands and feet, kind of a fibromyalgia like symptom you will see in Bovista, and there is intolerable itching at the tip of the coccyx, much scratch till the parts become raw and sore, and persons who suffer from tetary eruptions. So I have given the remedy Bovista for patients who have had eruptions, especially on the forearm, and menses every 2 to 3 weeks, which keep on repeating, and menses only flow at night. This is the combination which we need to look for when we are using Allen's keynotes and we are matching similar patterns in the patients. Next you have is relationships of Bovista. You can compare Bovista with ammonium carb, belladonna, calcarea carb, mag sulf, sepia in menstrual irregularities, and Bovista antidotes, effects of applications of tar. So you have patients who are dropping by from the dermatologist who have given some Harmful ointments, those will require Bovista as a remedy to prescribe. And if there are patients who are working in some factories, they have exposure to certain gases, Bovista can antidote it. Most importantly, if, like we discussed, in some cases of urticaria, when you will require to give this remedy as an acute, but you can also use this remedy as a chronic remedy if Rustox as a remedy has failed and you are at a period where no other remedy is working and there is just chronic urticaria with just this kind of a dermatographism which leaves some spots on the body of the patient or certain part of the patient. Bovista as a remedy given frequently, 1 m or 10 m maybe, if you can get it, given frequently can help such situations, and you will cure some of the most obstinate urticarias with the smallest remedy ever believed to cure urticaria. So what you read, you have to believe, and if you believe, it will cure your patient. That's all from today's session of Allen's keynotes. We have discussed two remedies, bismuth and Bovista, and we'll continue this Allen's keynote study streak till we finish the last part of few remedies. Some acids are left and some bowel nosores and some metals are left.